show you today is various techniques that are used on the patient for serious conditions. These are disc lesions, nerve impingement conditions, where you need to approach on a gentle, more non-forceful techniques. Okay, I'm going to ask Ron if you could lay face down, and we're going to address two conditions. The one being a possible lumbar disc compressing on the sciatic nerve, causing radicular pain down his left leg. And the other condition would be a cervical spinal disc lesion, once again, pinching a nerve and causing left upper extremity pain. Obviously, through our prior evaluation, we were able to diagnose these conditions and treat them accordingly. We'll initiate the care, as always, with a little traction in order to, once again, to palpate the areas of restriction and reduce any stress and tension in the body and the spinal segments. It's not uncommon for us, when a patient comes in with these conditions, for us to use other therapies and modalities. We have low volt muscle stim, we have heat, hydrocollator therapy, and we also have ice, cryotherapy, to facilitate the proper healing of these tissues. The first correction I'm going to demonstrate, which is considered a non-forceful technique, is called a Thompson drop table technique. Once again, once we determine the misalignment in the pelvis and the lumbar spine, we may contact this condition, and the table actually raises about 1/4 inch. Pressure is applied to the corrected area, which is the left sacroiliac, and the table will release. As the table releases, the correction is maintained. Also, with this correction, we have the sacrum that moved what's called anterior inferior on the left, and we're going to make a correction to the sacrum. Another technique that could be utilized, once again, for disc lesions, sciatica, neurological conditions, is called an SOT, sacral occipital technique. It's a blocking technique. In this case, where we see the SI has shifted, it's an L5-S1 disc lesion, causing stress on this area, we would use a blocking technique. In this case, I would put the block in the correction that's required, and an opposite block to counter that correction. Many times when in this position, we'll apply therapy on the area, either ice or heat with muscle stim, as the body maintains this corrective mode in order for it to retain the correction and take stress off that motor unit, which is the vertebrae above, the L5, the sacrum, and the disc in between, which makes up that motor unit. Everything comfortable?
Yes.
Okay. As we remove the blocks, once again, another technique we apply for patients that are in severe pain, need correction and stabilization, but need to be applied with non-forceful techniques, is a tool called an activator. An activator, when triggered, gives a small impulse. What this allows us to do is to correct motor units or vertebral misalignments in the spine without the use of force. This correction is then maintained by the human frame, the human body, reducing stress on that motor unit and the nerve tissue related to that area. I'm going to lay your face up. The activator technique can be utilized on all areas of the spine along with extremities. In the cervical spine, where it's very common to find disc lesions and nerve impingements, it's important that we use very conservative techniques to stabilize these areas. Once again, we're going to apply an SOT, sacral occipital step technique. A step technique is, once again, we understand where the lesion's at in the spine. Most commonly, these occur anywhere between the C5, C6, and C6, C7 spinal segment. We just actually palpate up and do light traction on these areas. These techniques are applied on a consistent basis as the patient's condition heals. Once we see the nerve component regain a certain potential of healing, we will incorporate certain stretches and exercises to enhance the tissues that that nerve supplies. Everything comfortable?
Yes.
Okay, let me sit you. Thank you.